We started the project in December of last year, 2014, with demolition. So this, as for the folks that don't know, was a former large big box grocery. And it was just big empty space.
And now the last time I was here, all I saw was a lot of welding and stuff going on. I think a lot's been done since then.
Yes, that was the structural steel that was going into the inside to essentially create a building within a building.
Okay, and as they come in the front door,
patients will be greeted here, and there are registration booths behind this wall and behind the other wall. We will also have in the big open space kiosks similar to grocery stores and airports where you can walk up and register yourself.
As you can see right now, there's wood, where glass will eventually allow plenty of natural light just inside the front doors.
We have this beautiful architectural stair that's going to have glass treads. It's going to be very modern looking.
Modern looking to match the forward thinking of bringing together a thoughtful blend of providers and services under one roof. Here is a first look at the floor plan for the first floor, with 2 entrances on either side. Walking through the right side doors leads directly to orthopedics.
So we'll have general orthopedics, pediatrics, pediatric orthopedics, adult reconstruction, which is joint replacement, hip and knee, and sports medicine.
In the center, along the back of the first floor, is where imaging services will be provided.
We have 6 imaging rooms here, 5 of which we will equip, and 1 will be shelled in for future technology.
And some of this space will house new technology that tests bone density.
To our left of the page will be spine and brain, so we'll have ortho spine and neurospine surgeons working here, as well as neurosurgeons doing brain treatments and care for patients.
Our neurosurgery team collaborates, offering care for dozens of conditions affecting the brain and nervous system, including brain disorders, spine disorders, pediatric neurosurgery disorders, and emergency neurosurgery.
The second floor is ahead of the first floor, but we're on schedule to open in January.
and tell me, how amazing is it to be on schedule with a project that's 117,000 square feet?
It's thrilling and a constant challenge. I really have to say the architectural team and especially the contractors have just been phenomenal. All the subcontractors, the general contractor, are local, so it keeps the money in our community.
The second floor looks a lot like the first floor, right? That's to allow for familiar interaction at different team stations throughout the facility. Along with physical medicine and rehab, hand therapy will be offered on the second floor, which is part of the Hand Center. Patients will also find physical therapy and occupational therapy nearby. Let's take a closer look at the gym space because Carilion's approach to treatment here is unique.
The benefit for the patient is a collaboration among the therapist and the physicians and advanced care practitioners who are treating the patient.
Another patient-friendly feature is a color-coded system for navigating services.
You'll notice the yellow colors in the exam rooms. That's for wayfinding. It replicates the yellow color at the exit door.
In addition to space for offices and an employee lounge, there will be education rooms for patients to learn more about their upcoming procedures.
The most dynamic thing about the layout and function of this space is that the exam pods are identical. You can flex them back and forth, so you can have multiple providers working together and collaborate face-to-face rather than being on separate floors or separate buildings.
The Institute for Orthopaedics and Neurosciences, a leader in medicine providing advanced care for patients. Karen McNew for Carilion Clinic.